Carrollwood Pharmacy and Compounding Center specializes in medical equipment and compound medication. This morning, we're happy to welcome back owner and pharmacist Dan Fucarino to tell us more. Good morning.
Good morning.
Welcome back.
Pleasure. Thank you.
So yeah, the last time you were here, we learned a little bit about what it is that you do. Why don't you real quickly kind of remind people why, you know, maybe if they're just going to their traditional big box pharmacy, maybe they should give you a look.
Absolutely. You know, what we do is we make customized medications. Not all drugs are made for all people. And so when you have a unique need, or need for a customized medication, that's essentially what we do.
And again, I love reminding people there are other options out there. And there's one thing we're going to talk about this morning, this LDN. Break this down for us, because this is something that you're seeing a lot of people asking questions about and coming in for.
Sure. LDN stands for low dose naltrexone. You may have heard the name naltrexone. If not, it's the drug that's used to get people out of opium, like an opioid, like oxycodone, hydrocodone overdose. They'll give this medication to get the person from having respiratory depression. It's a life-saving drug. But we're not using that drug for that purpose. We're using that drug for a different purpose. The receptor site that is normally used for the opium receptor also does something. When you give this particular drug, naltrexone, it has an affinity, an attraction to it, just like it does when you give the higher dose. But it doesn't have the same effect. Not only does it not knock out the opioids, which shouldn't be there to begin with, and we're not treating anything like that, it just causes that receptor site to send a signal to the response that you need, a normal response that you need for allergies and that type of thing. So to give you some example, your immunity is very important. If you have a hyperimmune response, we call that an autoimmune type.
You hear that a lot, yes.
So diseases like rheumatoid arthritis or autism, Crohn's disease, chronic fatigue, fibromyalgia, Hashimoto's, MS, Parkinson's, all those are autoimmune diseases. They're typically caused by a sensitivity to drugs, sensitivity to foods. So for instance, a sensitivity is different from an allergy. You don't always make a relationship. For instance, to give you an example, milk. If you are lactose intolerant, you're going to know within a couple of hours that you have had milk. But if you have a sensitivity to, say, casein, which is a protein in milk, you may not know it for months and years, but it's still attacking your body. So you have these foods, eggs, wheat, you've heard of gluten and all those kind of things. So the way this happens is that your gut has, and I'm talking about your intestines, of course, has this type of tissue called cilia. Cilia plays a very important part in your digestion. Number one, all the micronutrients that are going by are absorbed by these little hairs that are inside your intestines. And also, they protect the body from reabsorbing the toxins that are going through the bowel as well. So toxins are, your body makes toxins all the time and it has to filter them out. If this cilia is not there, and that's what happens, the cilia later becomes thinner and thinner, and now these toxins are reabsorbed back in they call it leaky gut. Okay,
which we hear, but we're just about out of time, so I want to make sure, though, that you get to why people need to call you and look into what you have there.
Right, so this medication for all those autoimmune diseases is an option that they should consider. Talk to their physician about it, because it may help them.
So is that who they would talk to first about it, or do they come to the pharmacy?
No, I mean, we can give them more information before they go to their physician if they wish to, but to go to their physician and ask them for it, and if they don't have doctors or the doctor doesn't want to work with them on this, we have a long list of doctors to do
So those issues that you mentioned, if someone is maybe watching from home this morning, is dealing with one of those, they need to possibly look into this, talk to their doctor, talk to you guys about it.
Absolutely.
All right, well, good to know. Again, glad to have you back this morning. I always learn a lot from you, so thank you so much. And again, there is info. If someone has any more questions, you can call, certainly stop by. We'll make sure and put the info on our website as well, tbmorningblend.com.